Hello, the topic of our conversation today is complications of intravitreal injections and how to prevent them. We are going to address a few possible complications and what we can do in a practical way to reduce their risk. The first possible complication of intravitreal injection is ocular surface problems. What happened is that the use of povidone iodine is mandatory, and povidone iodine as well as the anesthetic eye drops may cause some ocular surface disease. The three conditions possible for ocular surface problems are toxicity, allergy, or dryness. And this is what we need to do. After injection, the ocular surface must be washed, rinsed very well with a sterile saline solution or some contact lens solution. With that procedure, you're going to remove all the iodine and eye drops from the surface, and the risk of toxicity or allergy will be reduced. In order to overcome the issue of dryness, for patients with a dry eye, you may ask patients to apply artificial tears more often on the day after the injection. The second possible complication of intravitreal injection is cataract. Cataract may be caused particularly by the touch of the needle or the quick flow of the solution of the drug. Cataract can be transient, for example, for a hydration change in the posterior part of the lens, or can be permanent. In order to reduce the risk of lens touch, you should not angle too much the eye and then inject towards the lens. The needle should be directed towards the center of the vitreous cavity. So I like to ask my patients to keep looking straight, and then I go straight into the vitreous cavity. Another possible complication of intravitreal injections is increase in intraocular pressure. What happens is that the 0.05 or 0.1 ml volume may increase the pressure in the intravitreous cavity, particularly with the small eye volumes. It has been shown that the pressure right after injection goes to an average of about 30 millimeters of mercury, but it reduced in the next few minutes quickly to about 15, from 10 to 30 minutes after injection. If the patient complains of pain and has severe visual loss to light perception or no light perception, you should stay in the room, keep checking the vision. You may consider doing a little gentle massage to reduce the pressure, and ultimately, if after 1, 2, or 3 minutes the vision does not improve, you may need to do a little anterior chamber paracentesis. The third possible complication, rare, that may occur after intravitreal injection is intraocular hemorrhage. It can be caused by the flow of the medication or change in the pressure of the eye. Most of the cases resolve well. Another possible complication of intravitreal injection is retina tear. In order to reduce the chance of tear, you may want to inject the medication slowly into the vitreous cavity and penetrate the needle enough so the tip of the needle is not too close from the periphery of the retina. One more possible complication after injection is endoptomies. It's one of the most threatened complications, feared complication of intravitreal injections, and it may occur in about 1 to every 2,000 injections. Povidone iodine is key to reduce the risk of endophthalmitis. Povidone iodine has been shown to reduce the flora of the surface of the eye after 3 to 5 minutes. So it is recommended that it is applied at least 3 minutes before the intravitreal injection, and you may want to apply the iodine right before the injection as well. The use of antibiotics after injection has not been shown to be enough efficient to reduce the risk of endophthalmitis. Another possible complication of intravitreal injection is inflammation. Inflammation may be subtle, subclinical, or they may be something like a severe uveitis. Most of the cases of inflammation after intravitreal injection are mild. In our group, we have been investigated this event, and we hypothesized that the protein of the anti-VEGF agent may interact with the inner surface siliconized of the syringe and may cause some precipitates that may induce some inflammation in the eye. More severe cases of inflammation may be related to the drug itself or some autoimmune reaction by the patient. So in this video, we addressed in a very brief and practical way some of the most common complications of intravitreal injection, which are anterior surface problems, cataract, hemorrhage, retinal tear, inflammation, change in intraocular pressure, and infection. I hope you enjoyed the video, and I see you on the next video.